Hi there. My name's Nathan. I'm going to be your nurse today. Can you just verify your name and your date of birth for me, please?
Al Jones, 4873.
Okay, perfect. Just double check that wristband. Perfect. Okay, thank you. Appreciate that. So Hal, I have here on my computer, I show an order to start a Foley catheter. Okay, have you ever had a Foley catheter before?
No.
Or an indwelling catheter? Okay. So what it is it's a tube that goes up your urethra and directly into your bladder. So usually it's intended for when people are having some urinary retention or basically they're having trouble peeing themselves.
Oh, okay.
Does that sound like familiar for you right now?
Yeah, it's been a while since I've been able to pee.
Okay. So yeah, that's what this is going to be for, and hopefully that should help relieve that for you. And then typically it'll go for some period of time, and then we'll remove it to see if then you're able to urinate on your own again.
Okay.
So it's usually a temporary thing.
Sounds good.
All right, very good. Before we go ahead and start that, though, there are two items that are very common to those kits, latex and iodine. Do you have an allergy to either of those things?
Iodine.
Iodine. Okay, very good. All right, so that's an easy fix because that's what we use for cleansing. So I can just get a different thing. It's called chlorhexidine, and there's not typically an allergy, a cross allergy to that with iodine, so that one's usually fine. And then the latex is going to be in the tubing, so that's a good thing not to have an issue with. So I'm going to go ahead and grab my gear, and I'll be right back.
Okay.
Okay, thank you. All right, so I have a kit. I'm going to grab the chlorhexidine to replace the iodine, and I also am grabbing a set of gloves because these ones are tiny and they don't fit my hands. All right. So here, hey Hal, I'm back. So I'm going to just go ahead. I've got a number of things here. I'm going to just kind of get stuff set up kind of around my face. So this whole procedure, the main thing with Foley catheters that we want to avoid is an infection. Right, so because we're going directly up into your bladder, we want to make sure we're not introducing bacteria up into that space that can lead to an infection.
That makes sense.
So that's the main concern we have. So everything I'm going to be doing is going to be to maintain sterile seals, which is basically to say that it's aseptic technique. I'm not going to get any bacteria in you. That's the goal here, okay? So there's a few things I'm just going to kind of get set up so that I can make sure that through that whole process, I'm able to keep that, okay? I'm also going to have a helper. Laura is one of the aides on the unit. She's going to come in and assist to make sure that when there are moments that I can't use my hands because I got to keep them really clean, that she can help grab things for me, okay?
Perfect. Let me just
So
perform my
there's a few things.
hygiene.
I don't want things dangling off my neck. That can interfere with my field. I don't want things on my hands or wrists. So I'm just going to take all that stuff off, clear this up so we're ready to go. I'm going to go ahead and also raise you up because I'm pretty tall, and this bed is really low. So I want to make sure that I have a good working height for me. Okay, we're going to lay you back. And I am going to just raise your knees just a titch, okay, because that's kind of helpful. I'm going to keep the blanket on you for right now. I'm going to just keep getting set up, okay. As I'm getting set up here, we're going to start getting situated, and we're going to kind of get you situated and uncovered only when we need to, okay?
Okay.
Okay, so I'm going to just keep going with these things and actually seeing that height and how I want it. I want this even a little higher. Very good. I'm going to grab an extra table. I like having the extra space to work with. Very good. A little bit of a different angle, but it works. There we go. All right, I'm going to get this where I want it, so it's all set up. We're going to make sure we give you some privacy in the process of this, so that was provided. We just did that. Okay. All right, so I'm going to keep getting my kit set up. I'm going to put things where I want them. Move that chlorhexidine to the side. That's going to be one of the last things I grab. Okay, I'm going to go ahead and open this kit. Pull this out. And just take stuff off that I don't need. Things have been kind of shifted around in that process of pulling it off. That's okay. So, what I don't need are these. That's fine, but here's where, okay, so before I get too far into this, this is still non-sterile, so I can go ahead and touch that. That's okay, but I am going to go ahead, we're going to start uncovering you here. All right, and if we can have you pull your legs apart, thank you. A little kind of butterfly position would be best, but I know for your legs, you have a hard time with that. So we're just going to straighten your legs and put them wider. Okay. And then Laura, I'm going to ask you to put on a clean pair of gloves, please. We're going to go ahead and cover her. And I'm going to give you some cleansing wipes that we got right here. So there should be 3 in there. I'd like for you to please take a separate one each wipe. You're going to wipe down the middle, front to back, and then down each side, same front to back. Okay? Just a new one with each swipe. And then while you're doing that, I'm going to do this other hand hygiene here, squirting this into my hand. Okay.
I'm just going to open them all up because they're so tight.
They are, yeah. You do what you got to do. I appreciate it. Okay. Well, she's getting my hands cleaned and dried so that then I can get into the rest of this.
Okay. I'm just going to set these right here for a second. I'm going to go ahead and open your labia up and do 1 wipe.
Perfect.
2 wipe. And a 3rd wipe.
Okay. Got a little shifted, but that's okay. We'll take that off. Alright. I'm going to go ahead and I'm going to start opening. I'm going to practice it just a little bit. I like to angle it so that when I open, it's right where I need it to be, and I'm avoiding reaching too much over when things are uncovered. There we go. There we go. Okay. And then I can still grab this 1-inch border if I kind of need to stretch things out a little bit to fit. I'm going to just pinch to grab these gloves here. I don't like these, they're too small, so I'm going to toss them to the side, and I'm going to grab these instead. Okay. Alright. So now that I've got this set here, I'm going to still open it up. And this is a non-latex version, which would have been good if they also had latex allergies, but we're all set. I'm going to go ahead and unfold these. I'm going to uncrease as much as I can while I'm holding onto the outside, which is going to be the non-sterile part. This is part of that whole keeping things really sterile. So I can grab these edges and be careful that I open this up and stretch it out so that I can still touch this 1 inch. I have 1 inch that I can touch of this border, which is just a little bit more than this side fold because it's a tiny side fold. More like what this top fold is. Okay. I'm going to just try to make sure it doesn't flop back closed on me. Okay. Now I'm going to go ahead and grab the inside of this one. I like to put my right glove on first because that makes things easier for me now. This is coming up, so I'm going to touch my non-sterile part of the thing. There we go. Now it's not flipping around as I try to put it on. Now, that just flipped, and it barely, but it did. It brushed my finger. It brushed my finger, so I got to be careful with that. So what I would do is I would say, hey, Laura, can you go grab me a new set of these sterile gloves? Which then she'd bring for me. Thank you. And I would open them up, and I have a new kit, and I just got to this point, and we did it again, and that's okay. But now I'm going to be careful, keeping the fingers down so they don't flop around. And I'm going to pull just from the inside to pull it down and over. Okay? And now with this one, now I might need to hold on to this edge again because this one might be sticky too. Okay, not too much. All right. But I'm holding on to the non-sterile corner because that's okay. Now I've got my big scoop in there. My thumb is on that side. I'm going to go ahead and keep this one out of the way and get these fingers in. There we go. Keeping from that side. There we go. Sterile gloves. Now, keeping my hands, her hands, in some form together, T-Rex hands, whatever it takes. Okay, so keeping them here. All right, this is where particularly I need to be careful with what I touch, because now I got these sterile gloves on. So this is where, Laura, if I could have you come back and help again. So I'm going to just drop this right there for you. If you could pick that up, please, and open it up. You're going to go, shiny side is going to go down. If you could place them under Hal's hips there for me. Thank you. This one I don't need, so I'm going to just toss it off to the side over here. I also don't like having this stat lock on it. It gets in my way, and it flops around where I don't like it. So I'm going to flop that over there too, because I don't need it till the end. I am going to get a different lube because of the mannequin. but we all agree that this was just the lube that was there the whole time. Nothing happened. Okay. Alright, so this is the way it was. Now, this iodine, don't want that, so we're chucking that. Okay, don't need this specimen cup, so I'm just going to get this out of my way too. I'm just going to clear all the stuff that I don't need to use out of my way, but I'm going to put them in such a place that they're not going to come back to my sterile field. I got to be very careful about that. Alright, so now what I need, with this, okay, but what I need to replace that iodine is some chlorhexidine. So I have that package. Yes, you grabbed it. Thank you, Laura. So if you could just open it and peel it open such that you're only touching the outside, and then I will grab the inside. Thank you. Perfect. So I'm going to go ahead and I'm going to pour this chlorhexidine onto these. Okay, I'm going to toss that over there. All right, so while these are soaking, I'm going to get this ready. I've got my lube here. I'm going to go ahead and just put this in the tray, maybe. There we go. Okay. And again, I'll just kind of toss it out of the way, being careful not to touch this. I also want to just go ahead, actually before I do that, I'm going to pull this off. So I'm going to be very carefully pulling this out so as not to touch things. Very carefully, not pulling behind myself with that. I am going to now dip this into the lube to get it in there. So this lube is going to help make sure that it goes in nice and smooth, because it shouldn't be painful as it goes in. It might be a little uncomfortable though, and that's pretty normal. It's just kind of an odd feeling, but it shouldn't hurt. Alright, let's keep that in there. This is my little syringe for the balloon. Okay. And now that I've got all of this, ooh, careful about it flopping. Okay. Okay, so this is where I have two options that I can use to then insert the Foley catheter. One is to take the tray with me, and the other is to only pick up, like leave all the tray, all of it from here, and then only take what I want. So I am going to do option one first, where I take the tray. So option one, taking the tray, I'm going to pick this up. So please, like I said, I want to avoid touching your legs, so please hold them still. Don't wiggle around. I'm going to just set this right here where I can reach everything I need. Very good. Now I'm going to go ahead, I'm going to just go ahead and spread this labia here to make sure that we can access it, and then I'm going to grab these chlorhexidine swabs. I'm going to go ahead and do one down the middle, and now I'm just going to go ahead and I can either drop it here on the floor, or if, because I've come this way and around, I can drop it on that, so that's okay. I'm going to grab this other one, and go down one side. Same thing, avoiding going over that. Now I'm going to grab this last one, other side, go in there. Alright, so now that we got you all cleaned up, I'm going to go ahead and I'm going to grab this catheter, and we're going to start getting ready to insert it. So I am going to be very careful it doesn't slip and touch your leg. Okay. And I'm going to fold it up real nice so that I've got a hold of it. Alright, we're going to go ahead and spread that labia. And careful not to touch. That was so easy. There we go. Okay, that's what it should be. Okay, there we go. Nice and easy. Very careful not to touch your labia as I just slowly insert this. Okay, there's should have been a flash of urine by now. Pretty sure we saw it. There we go. All right, I'm going to go ahead. I'm going to hold on to this just in case I need to maneuver anything. I'm going to reach across to grab this and inflate that balloon. This is a weird angle for me, so there we go. So while that is inflating, I'm going to go ahead and give it a tug. Yep, see, that was way more than we needed. That's fine. All right, now that it's in, I'm going to detach. Okay. And my gloves don't need to be sterile anymore, so we're fine. All right, but I am going to grab my stat lock. There's the perforation. Always look for the perforation. Don't make it harder on yourself. All right, now this is some skin protectant just to kind of help make that a little bit better for you. So I'm going to just kind of get this on your thigh. Okay. And now I'm going to go ahead and I'm going to get this ready. Ooh, that's got real sticky with the skin protectant. Okay. Now I want this angled like that. All right, yeah. I'm going to get this ready. We're going to put this on your thigh here. Again, super sticky. That's good. So that skin protectant is going to make sure it sticks to that instead of your skin directly. All right, and then this I can swivel around. So I've got a nice little loop here, not a full loop, but like some slack, so that now it's going to tug there instead of tugging on your bladder. All right.
That's nice.
Yeah. All right. And I can see it's already starting to feel a little better. Are you starting to feel a little better?
For sure.
Good. All right, we're going to bring this down. I'm going to move some things. I'm going to set this down below your bladder onto a non-movable part of the bed. Okay, there we go. All right, actually these gloves have kind of like gunk on them and stuff, so I'm going to take these off. There we go. I'm going to throw these away. I'm going to grab a new set of gloves. Or actually, Laura's here. She can help me out. So, Laura, if you wouldn't mind, could you please just do some peri-care to just wipe that chlorhexidine and that lube off, since you've got those wipes. Appreciate it. I'm just going to keep, I'll just put these on and keep cleaning. That's fine.
There we go.
Okay. Thank you much. So now that we got y'all cleaned up, let's cover you back up. I'm going to take all this garbage out. Cover you. There we go. I'm going to clean up the stuff I put on the floor. And all of this we're going to throw away. Alright, we are all set. Alright, how are you feeling? Feeling better?
Much better.
Alright, good. Do you have any other questions for me right now?
I don't think so.
No? Okay. I'm just going to keep cleaning some stuff up. I'm going to lower your bed. Get this cleared out of the way. Well, we'll get that in a moment. Okay. All right. Okay, so let me just get that all off. Now if you do have any questions or concerns that come up, you've got a call light right here and on this side too. So you just let me know, okay?
Okay.
All right, perfect. Thank you very much. All right, it's 3 days later. I have an order to remove the Foley catheter for Hal Jones. I just double checked it and it is correct. So I'm going to grab some things. I'm going to grab a 10 ml syringe for emptying that balloon. I'm going to grab some wipes for peri-care and then just a little extra towel for me, just like I told out. I like to have that handy. So, hey Hal, how are you feeling today?
Pretty good.
Pretty good. All right. So it's me, Nathan. I'm back again. Good to see you.
Good to see you.
And today I actually am going to be removing that catheter. So that's going to be a little bit for you.
Oh, good. I am excited. I'm ready for it.
Good. Okay. So just to be sure, before I start doing that, I want to verify that I got the right person. So can you tell me your name and date of birth, please?
Hal Jones, 4873.
Perfect. And it matches your wristband. All right. Thank you. So yes, I do have that order to remove that catheter. So I'm going to go ahead and raise you up. Now this is going to be an easier, simpler procedure than filling you in. Okay, much easier for you. All that's going to happen is I'm going to empty the balloon that's in your bladder that's holding it up there, and then just pull it up.
Okay.
So it might feel a little odd. It might feel like you're peeing yourself. It's okay. That's a normal thing as the tube is being removed. It feels like that's happening, and you're okay.
Okay. Perfect.
If you're feeling really uncomfortable, any pain or anything like that, let me know, okay?
Will do.
All right. I'm going to go ahead and put some gloves on. And yeah, since we're taking this out, it doesn't need to be sterile like the putting it in was.
Oh, that's good to know.
Like I said, so much easier, the whole process. All right. I'm going to go ahead and uncover you. But before I do that, I'm going to actually give you some privacy. Let's start there, okay? Did that. Then I'm going to uncover you. All right, I don't even need to do that much. All right, and just get to this. Okay, now I'm going to go ahead and I'm going to undo this. All right, we're going to get this connected. Here we go, we're going to empty that balloon. And that, I should get 10 mils back out because that's how much I put in. But I'm going to pull back a little bit more just in case someone snuck some in that I didn't know about. Okay, nope, still 10. We're good. All right, perfect. I'm going to just take that out for a second. It's not out of my way. I like to use this little rag just so that we don't fling any urine anywhere. I'm going to cover that up. I'm going to slowly pull it out. There we go. All set. How you feeling?
Good. That was perfect.
See? Super easy, right? All right. I am going to go ahead and get this. Realistically, I would have emptied this beforehand so I could do the output, but I'm going to make sure I note that I am going to, in fact, check that output. I'm going to put it in a biohazard, which we're going to say is this right now. Okay. Okay. And I'm going to just go ahead and do a little bit of pericare because there might be a little bit of dribbling from just the end of that coming out, and that's okay. All right, so we're going to just go ahead and get you nice, little clean. I'm going to switch to different parts. They'll just kind of wipe you out. There you go. How are you feeling?
Much better.
Much better. Okay. Oh, I did miss this. I want to take that off. So actually for this, I would have also brought a little alcohol swab. Thank you, Laura, my assistant. Okay. So I'm going to find a little edge to peel up. And this is easier on a real person, but there we go. I'm going to just kind of peel up the edges and kind of use the alcohol. Kind of snatch the edges up. There we go. Pulling that off.
That feels much better.
Yeah. All right. Very good. So as soon as we see that you can pee, I think you're okay to go.
Oh,
Do you
good.
have any questions for me right now?
Nope, I don't think so.
No? Okay. So I'll just remind you, if you need to get up to go to the bathroom, just go ahead and hit your call light right over here. There we go.
Perfect. Thank you.
Thank you. You have a good day. And then just go ahead and clean the hands one more time, and I'll be back to check in on you.